Alex, and about 5 months ago, we decided to do some signature athleticas, laser guided Wharton's jelly therapy for the old knee injury you had. What was that, during rugby? You tore some of your ligaments,
Posterior cruciate.
yeah, post PLL, and then hobbling in pain for all these years. So 5 months after, so what was the knee like before, and what results have we had?
So I had chronic pain throughout the day, and then sharp shooting pain every once in a while, depending upon usually torsion. Was
Like twisting the knee would
twisting,
light it up.
yeah.
Okay.
And also any sort of physical activity, tennis or what have you, was followed with a long period of pain and recovery. And going upstairs was a problem, and just generally it was degenerating rapidly. So came in.
All right. And what is the knee like now?
So it's great. It feels great. I don't have residual pain during the day. Even after walking for an hour each morning, there's no appreciable pain. I haven't been doing tennis or any of the other stuff I used to or would like to yet, but I also don't have those sharp shooting pains, on just everyday activities. Going upstairs isn't a big deal.
And now that you're more mobile, looks like you lost a bunch of weight. How many pounds you lose this past year?
I started in with the Prolon and then with the water and walking an hour each morning, and dropped 30 pounds from August to...
That's incredible, and that's more pain. That's more pressure off your knee. Yeah. Everything just helping. So, if you had to put a number on your percent of improvement, what would that number be?
Well, initially I was so euphoric, I was saying 90%. But I guess I'd say like 75% at this point.
That's still amazing, because remember I told you for this old knee injury, it's going to take about a year to rehabilitate, and you get about 10% improvement a month. We're at month 5. Mm-hmm. Most people would be 50% better. You're 75. You're way ahead of the game. All right. So today we're going to do a shockwave treatment. It's going to kind of boost the cells. You keep them activated, and we're going to have a follow up in a few months just to make sure you're right on target. All right.
Perfect.
Congratulations. We'll keep on monitoring your progress.
Thank you.
All right.
Yeah.